This segment sponsored by GBMC Healthcare.
It's something that doesn't get enough attention, prostate cancer. It was recently reported that Maryland Senate President Mike Miller Jr. has metastatic prostate cancer.
So today we're getting the facts on this disease from GBMC radiation oncologist, Dr. Robert Brookland. How are you?
I'm very well, thank you.
Yeah.
Thanks for being with us.
So for those who don't know, what exactly is prostate cancer?
Well, cancer is a disease where the cells divide without control. They invade into adjacent structures. They can spread to other parts of the body. And prostate cancer starts in the gland that lives right under the bladder. And so it's only in men. And it is actually the most common cancer that a man is likely to get as long as he doesn't smoke. And then for smokers, it's lung cancer.
Sure. So are there any risk factors that increase somebody's chances of developing prostate cancer?
Well, for a minority of men who have a strong family history, that would be a risk factor. Otherwise, for most men, for 6 out of 7, we really don't know why it develops.
Gotcha. So what are some of the early symptoms?
Most men actually don't have symptoms. We find out about the disease because of screening, because they've gone to their physician who's done an examination and felt something abnormal, or even more likely, has done a screening blood test called a PSA test. And when that blood test comes back elevated from expected, that prompts looking further into it. And that's how we find this disease in most men.
Gotcha.
When do men start getting screened for prostate cancer, and how frequently should they be getting screenings?
Most men will be starting their screening at age 50. If there is a family member or first-degree relative, you can move that up to age 45. And if there's, actually, for African Americans, you might also move it up to 45 in that group as well. And then for multiple family members with the disease, you could start as early as age 40. And you would continue screening until someone's life expectancy falls to less than 10 years, and then you might consider not screening anymore.
Yeah, you know, we were talking about this off camera, how my grandfather had prostate cancer. Fortunately, you know, he's still here. Is this disease curable?
It absolutely is curable. In fact, the vast majority of the men with prostate cancer will die from something unrelated to prostate cancer.
Well, that's good to know.
That is. So what are the treatment options that are available?
So the first thing we look at is what is someone's risk of disease, because for many men, you might just watch it carefully, and we call that active surveillance. If we're dealing with an intermediate or a higher risk cancer, then the treatment choices are usually either surgery or radiation, and the cure rates are identical with both of those approaches. Sometimes we also add in some hormonal therapy as well.
Okay. And so as you mentioned, you can have observation as a treatment. You don't necessarily have to go straight into something like radiation.
No, you just have to have a nice, in-depth discussion with a radiation oncologist and urologist to talk about the full range of options, and then make a decision based on those recommendations as what would be best in your individual situation.
Sure. Gotcha. So is there anything that, you know, people can do, like, let's say, lifestyle changes to prevent this disease?
Good, healthy lifestyle is always a good recommendation. So not having a diet that's too fatty, for example, getting most of your protein sources from plants rather than animals, not too much red meat, good exercise, being physically active, 150 minutes a week of aerobic type exercise, some weight training. These are things that work for everybody, and it's also good from a cancer perspective.
Well, doctor, this has been so informative. Where can we go if we're interested in learning a bit more?
Well, the American Cancer Society has a wonderful website at cancer.org, and that's an excellent resource. Of course, at GBMC, we have wonderful resources at our cancer center, the Berman Cancer Center, and that's a great resource also.
Great. Thank you so much.
This conversation is needed, so thank you.
Thank you.
We appreciate it.